Today I'm going to talk about calcitonin. The body calcium level is influenced by the three hormones: parathyroid hormone, vitamin D, calcitonin. Parathyroid hormone and vitamin D help to increase calcium levels, but calcitonin helps lower calcium levels. Extracellular calcium included in the blood and interstitium. Extracellular calcium divided into two components: diffusible, non-diffusible. Diffusible calcium. Diffusible calcium can cross the cell membranes and divided into two categories. First, free ionized calcium that involves in all cellular processes like action potential in neuronal cells, contraction of skeletal, smooth, cardiac muscle, hormone secretion, blood coagulation. All of these are highly regulated by hormones and enzymes. 2. Complex calcium. Calcium that has positive charge bound by tiny negatively charged molecules like oxalate and phosphate, ions that found in the blood. These complex calciums are electrically neutral and not useful for cellular processes. Non-diffusible calcium. Non-diffusible calcium, which calcium binds to large negatively charged molecules like albumin. So these molecules are very large and cannot cross the membranes. Non-diffusible calcium is uninvolved in cellular processes. Now, calcitonin. Calcitonin is a polypeptide hormone produced by parafollicular cells of the thyroid gland called C cells. Thyroid gland contains thousands of follicles which produce thyroid hormone. Parafollicular cells are adjacent to follicles. C cells or parafollicular cells produces pre-procalcitonin, then cut off to procalcitonin, then again cleaves into calcitonin and accumulates to secretory granules in cells. The normal blood calcium level is between 8.5 to 10 milligram per deciliter. Changing in calcium levels sensed by calcium sensing receptors on the surface of C cells, and when it goes up, C cells release calcitonin and lowers blood calcium level. Of course, the exact role of calcitonin in the body still well not understood. For instance, when body cannot produce calcitonin, like patients with surgical removal of thyroid gland, it means thyroidectomy, the regulation of blood calcium levels does not affect it significantly. Calcitonin put its effect, it means lowering of blood calcium level, in two ways. First, its effect in the bone. The major effect of calcitonin is effect on bone. The second is its effect in the kidney. The minor effect of calcitonin, of course, is its effect on kidneys. Major effect of calcitonin: when calcitonin binds to its G protein coupled receptors on the surface of osteoclast cells, activates adenylate cyclase enzyme, then increases levels of cyclic AMP via conversion of ATP to cyclic AMP. Then cyclic AMP decreases osteoclast activity. Decreased bone resorption and release of calcium and phosphate results in decreased blood calcium levels. Minor effect of calcitonin. The minor effect of calcitonin, of course, is in the kidneys. When calcitonin binds to its receptor on surface of principal cells of distal convoluted tubules, decreases calcium and phosphate reabsorption by principal cells. So increased calcitonin levels results in increased calcium phosphate loss in the urine. It means calciuria and phosphaturia we will have. So that decreases calcium and phosphate in the blood.